Accelerator. Joining us remotely, Dr. Kate O'Brien, Director, Immunization, Vaccines and Biologicals, Dr. Janet Diaz, Team Lead, Healthcare Readiness. We have also present in the room a member of the international team to China, Dr. Peter Ben Imbarak. He is also an expert at WHO on food safety and zoonosis and team lead of the international team, and joining remotely is Professor Marion Koopmans, head of the Department of Virus Science at the University of Rotterdam. Now, without further delay, I would like to hand over to Dr. Tedros for his opening remarks. Dr. Tedros, please, you have the floor.
Thank you. Shukran, Fadila. Good morning, good afternoon, and good evening. As you know, the expert team to study the origins of the COVID-19 virus has completed its trip to China. This was an international team comprising experts from Australia, Denmark, Germany, Japan, Netherlands, Qatar, the Russian Federation, the United Kingdom, the United States of America, and Vietnam. The team also included experts from WHO, the Food and Agriculture Organization of the United Nations, and the World Organization for Animal Health. I want to start by thanking all members of the international team for their work. This has been a very important scientific exercise in very difficult circumstances. The expert team is working on a summary report, which we hope will be published next week, and the full final report will be published in the coming weeks. We look forward to receiving both reports, which will be released publicly. When the summary report is published, we will hold a further press conference with the full international team. Some questions have been raised as to whether some hypotheses have been discarded. Having spoken with some members of the team, I wish to confirm that all hypotheses remain open and require further analysis and studies. Some of that work may lie outside the remit and scope of this mission. We have also said that this mission would not find all the answers, but it has added important information that takes us closer to understanding the origins of the virus. The mission achieved a better understanding of the early days of the pandemic and identified areas for further analysis and research. And we will continue working to get the information we need to answer the questions that still need to be answered. Today, we're joined by two members of the international mission, Dr. Peter Ben Imbarak, the team lead of the international mission, and Professor Marion Koopmans, head of the Department of Viroscience at the University of Rotterdam, the Netherlands. Dr. Ben Imbarak and Professor Koopmans will be available to answer your questions. Meanwhile, the number of reported cases of COVID-19 globally has declined for the fourth week in a row, and the number of deaths also fell for the second consecutive week. These declines appear to be due to countries implementing public health measures more stringently. We should all be encouraged, but complacency is as dangerous as the virus itself. Now is not the time for any country to relax measures or for any individual to let every life that's lost now is all the more tragic as vaccines are beginning to be rolled out. Alongside traditional public health measures, how quickly we can collectively expand vaccine manufacturing and roll out vaccines to all countries will determine how soon we can control this pandemic. At the beginning of the year, I issued a global challenge to ensure that vaccination of health workers and older people is underway in all countries within the first 100 days of 2021. Next Friday marks day 50. Today, I'm inviting everyone to join me in a call to action to accelerate production and share technology so we can produce enough vaccines for the world and share them equitably. Some people didn't think it was possible to produce a vaccine so quickly, but it was, and very historic. Never in the history of the world had we actually developed vaccines in less than a year after the emergence of a new virus. Now, some people say that vaccinating the world is not possible. They are dead wrong. As Nelson Mandela Madiba said, it always seems impossible until it's done. So join me. Wherever you live or work, sign onto the new declaration and let's build a movement to make history together. It's everybody's responsibility. Vaccines are vital not only for saving lives, but also for preventing the long-term effects of COVID-19, which we're only beginning to understand. WHO's work in this area focuses on three key needs for these patients: recognition, research, and rehabilitation. Earlier this week, WHO held a global meeting of patients, clinicians, and other stakeholders to advance our understanding of what is officially called post-COVID condition or long COVID, discussed with very distinguished colleagues and people. This was the first in a series of meetings and focused on working towards an agreed clinical description of the condition, which will be important for clinicians to diagnose and treat it. This illness affects patients with both severe and mild COVID-19. Part of the challenge is that patients with long COVID can have a range of different symptoms that can be persistent or can come and go. Earlier this week, WHO released a case reporting from that will allow more data to be collected on long COVID in a standardized way. This will help to improve the understanding, surveillance, and clinical management of the condition. Given the scale of the pandemic, we expect many people to be affected by post-COVID-19 condition or by long COVID. And of course, the best way to prevent long COVID is to prevent COVID-19 in the first place. Finally, yesterday was the International Day of Women and Girls in Science. And I would like to pay tribute to all of the incredible women scientists who work for and with WHO all over the world, including those at this press conference: Janet, Kate, Maria, Maria Angela, Soumya, and Marion. And also all colleagues, Gabi, Fidela, Aurora, and others. I want to say to all of you that you are an inspiration to me. And I hope you are an inspiration to many girls and boys around the world. And finally, I would like to wish everyone who observes it a very happy Lunar New Year. Fadila, back to you.
Thank you, Dr. Tedros. I will now open the floor to questions from members of the